I'd given up on hospitals and doctors. You know, it felt like a number, and if you didn't have money to pay them, you were, you just felt like you were going to die. So they just made me feel human again.
It's totally different from private practice. Here you are, you're working with people who are uninsured, and with that, there's obstacles that come with that, finding specialists who will see the patients or, medication specifically for the patients. But, once I accepted the role that was placed before me, I'm so blessed that I did, because with those obstacles, there's the sense of joy that you're actually helping. It's not just another patient coming in, but these are patients who truly need your help.
Well, it's kept me alive, and I think that's a vast improvement over being 6 feet under. When I first encountered Hope, I came because I had a raging infection in my throat. And, they, God bless them, took care of that, made sure that I was on the road to recovery, and have consequently done follow-up care as well.
And I have not had any problems. If I call and I'm sick, they tell me to come in and see the nurse. Well, if they see I'm real sick, then they'll get me in to see Lisa or someone like that. And now I can just call and I can get here if I need to.
Well, there's a lot of people here that don't really have, like myself, they really don't have the money to be able to go to a regular doctor. And, the Hope Clinic, health clinic, they're just like really there for all the medical uses that really will keep you alive. They really will keep you alive. And, what more can I say?
And the medications were ridiculously expensive, and I couldn't afford them, and my heart doctor recommended I come here. And since coming here, I've gone from 10 pills a day to 4. My lab work is great. I've just been accepted into a clinical trial, and it's a second chance. I mean, I'm going to live.
It was very smooth. I mean, it was, they got some background as far as my, health and health issues, and got a treatment plan started for me, being that I had not had any recent doctor, visits because of the lack of insurance and things of that nature. So they got a plan for me to start taking care of me. And
Dennis Seaton, she was working in my mouth and she couldn't get the silver to work. And she called Mr. Curbo in. Mr. Curbo come and he said, we're gonna do this because we want your smile pretty. And when he said, we want your smile pretty, he said, go ahead and fix her. And it blessed me.
Here you get the same service, but not the price. And a lot of people don't have money to go to a regular doctor or insurance. And without the Hope Clinic, we wouldn't be able to see anybody.
If I didn't have the Hope Clinic to turn to, it would most likely be the medical emergency hospital.
Every single person that I have been blessed to encounter at the Hope Clinic has been absolutely exceptional. You would not believe the care and the compassion and the expertise that they have. I feel more comfortable here than I do at a hospital facility.
It took me becoming involved in my own situation to get better. And now that I've done that, it's just, it's amazing. I mean, you have to take responsibility. You can't just expect a pill, and take a pill every day and keep your same habits. I mean, you have to change. It's not just the clinic's responsibility, it's your own personal responsibility. But basically, the Hope Clinic, I'm alive because of the Hope Clinic.
But overall, it's gratefulness that you're taking time to talk with them and to treat them as a person. And a lot of the people who come here they don't have the smiles that you give to them, or the thank you for I'm proud of you or anything like that. So I try to do that with my patients, and to see the gratefulness for what we're doing in their face is just wonderful.
What we have in today's world is a very large percentage of our fellow citizens are uninsured. Their only medical care is showing up at the emergency room in the hospital, which overloads the emergency room. It's sort of a waste of resources. 20%, according to the hospital numbers, of those coming into the emergency room are non-emergency patients, just don't have the capability of supporting, providing their own primary health care. So this clinic takes a load off the hospital, hopefully reduces the congestion, and does it much more cost effectively than the hospital.
I am a proponent of a full wellness center, and I think that idea is what's going to make us unique.
Total effect. So this clinic, to be successful, has to change the way many people live and help educate them into what is a healthy lifestyle, minimize the medical problems, and succeed in totality.
We currently see about 1,200 patients a month in the medical side, and we see about 185 to 190 in the dental side. We feel like the capacity in those areas, the medical area, is probably to go up to 1,500 with the patients that we have. Of course, scheduling plays a real part into that.
C is for a patient to come in with, whether they have a disease or not, but get well and then learn how to stay well. And that's our charge, is to bring them in, teach them these lifestyle choices, and to keep them out of this clinic.
Hospital Authority. The hospital has been very good to us here in Griffin. Last year we were having a difficult time because of lab fees, and we began talking to the hospital about the possibility of them covering our lab fees or doing our labs or whatever would be the most economical for them. Fortunately, we were able to get that through and with them, and they are now doing all our labs, which saves us a lot of money a year, over $100,000 a year. The Hospital Authority currently funds over 50% of our operational budget, and they see the need in our community. We have approximately 14,000 uninsured people in Spalding County. The Hospital Authority would love to fund us even more, but just like everyone else who's invested in any type of investment options these days, the earnings from those are less than they have been in the past, and they can't do it.
Okay. My name's Ed Worrell, and my role with the Hope Health Clinic is that I just love the organization. I think they do a fantastic, they have a fantastic service to our community, and I'm a contributor, financial contributor is really my role here. I let people like Harry Kerbo get in there and do all the legwork and make things happen, and Dr. Hitson as he heads up the staff here, but my role is primarily one of a financial contributor to this great organization.
I think our goal is to find a way to fund ourselves. I would like to. I'd like to know that the Hospital Authority is always going to participate. They're such a huge contributor to this organization. But we've got to find ways of new revenue. We've got to find ways to fund ourselves. So,
for those of you who are sitting on the fence that are thinking about contributing but just don't know if it's the right organization, again, I think that helping people feel better so that they can be motivated to make their lives better is so important. And because of our economy and the way it is, it's hard to have a direct impact on people's life that's immediate. Let's face it, if you're feeling bad, helping someone feel better, you make an immediate impact on their life. And the way they correspond and respond to family members, the way they get along with their coworkers, again, the way a person feels makes a difference in every walk of their life. So this is a great place to contribute